In Georgia's K-12 schools, teachers identify students in distress every single day, but the momentum to get help usually comes to a sudden stop. Acknowledging a student needs care leads to an invisible barrier, a severe shortage of qualified professionals who are actually taking new patients. The logistics are difficult. Parents navigate outdated directories, landing on months-long waitlists. And if a family requires a therapist with specific cultural competencies, the search becomes nearly impossible. Spotting the warning signs of a mental health crisis serves no purpose if the physical pathways to deliver treatment are broken. Even when a family finds an available provider, the out-of-pocket cost for weekly sessions prevents a significant percentage of students from receiving care. Meanwhile, school administrators face their own regulatory pressure. By July 2026, all public schools in Georgia must comply with HB 268. This state mandate requires the districts to implement and maintain comprehensive suicide and violence prevention programs within their buildings. This creates a dual crisis. Families find care out of reach, and schools lack the internal budgets. The current framework leaves vulnerable students without a safety net because access to care has been tied to a family's income bracket and a school district's zip code. MentalSpace School operates as a dedicated K-12 mental health infrastructure designed to bypass these exact barriers in Georgia. Instead of sending parents back to external directories, the platform provides students with same-day teletherapy sessions, removing months-long waitlists. Each participating school is assigned a dedicated team of licensed therapists. These teams include culturally diverse practitioners to ensure students have access to professionals who understand their specific backgrounds. The platform extends beyond individual student therapy. It integrates active crisis intervention protocols, wellness programs for school staff, and counseling services for the entire family unit. Because the entire system is compliant with HIPAA medical privacy laws and FERPA student record regulations, it removes the usual administrative hurdles for the district. By plugging in this ready-made system, schools operate as comprehensive care hubs without adding extra duties to the existing teaching faculty. Quick quiz. How much does therapy cost for a family on Georgia Medicaid using this system? This animated equation illustrates the true out-of-pocket cost. If a family uses Georgia Medicaid, the output resolves to exactly $0. If we shift the inputs to represent commercial insurance providers like BCBS, Cigna, Aetna, UHC, or Humana, the equation resolves to a standard minimal copay. This specific financial structure decouples a child's right to mental health care from their family's economic status. When these logistical and financial barriers are removed, we can see the change in the school environment. This chart tracks the clinical outcomes of the MentalSpace platform. Compared to the baseline, the data shows a 92% reduction in reported student anxiety levels. When we expand the visualization to include academic tracking, we see a correlated 89% upward trend in student attendance occurring alongside that drop in anxiety. Adding a final metric block for the community response reveals an 85% satisfaction rate among participating families. These metrics demonstrate that mental health intervention is a core driver of academic success and community stability. Achieving these student outcomes also means the school district meets the requirements of the 2026 HB 268 compliance mandate. The ability to receive professional psychological help should never be determined by a lack of access or income. Share this information with a family who might need support, or with school administrators searching for a reliable compliance solution. You can direct them to MentalSpaceSchool.com or reach out to MentalSpace School at chctherapy.com to initiate the integration process for your district. MentalSpace School provides the necessary bridge to making mental health care an accessible standard in Georgia education.